Child health. The preschooler. The preschooler maintains a steady pace of growth. During the preschool years, the bones of the arms, legs, and trunk grow rapidly. Muscular growth is significant with improvement in muscle tone and strength. The brain, lungs, and heart function better. The needs for growth and activity determine the nutrient requirement. The discussion which follows will tell you about the nutrients to emphasize in the preschooler's diet and the points to keep in mind while planning meals and snacks. Meal planning for the preschooler. The preschool years are characterized by fairly well-established dietary preferences and increased ability of the child to exercise her independence in selecting foods and in feeding herself. The following chart are the major do's and don'ts in the feeding preschoolers. The preschooler. Do's. Include food from each of the food group in each meal. Serve foods rich in energy, protein, vitamin A, calcium and iron. Provide small, frequent meals. Include nutritious snacks between meals which are easy to handle. Prepare meals according to the likes, dislikes of the child. Provide more food in easily digestible form during illness and recovery. Ensure that meal times are relaxed. Don'ts. Never force the child to eat. Try not to use food as a means of reward or punishment. Do not restrict the food intake when the child is ill. Do not let snacks take the place of main meals. Avoid serving food that are too hot or too cold. Do not let the child eat too many sweets, sticky foods or convenience foods. Avoid highly flavored or spicy foods. The preschooler often goes to a child care center. This would mean having to make adjustments in timing, nature and frequency of meals. It is important that she begins the day with a good breakfast. This helps to keep the child alert and active. Some preschool centers provide a mid-morning meal, an occasion for children to eat together and have fun sharing their food. Other centers rely on the parents who send packed lunches for the children. Preschoolers often enjoy helping in feeding of younger children. So if there are younger children in the child care center, the preschooler in your care can also participate in their feeding, though it should always be under close adult supervision. Along with this, they could eat their own food too. Planning meals and snacks at child care center. Your role as a child care worker includes planning meals and snacks to be served at the child care center. The main steps you could follow are as follows. List the names of suitable meals, snacks you could serve which are nutritious, easy to prepare and easy to handle for young child. List the ingredients you would need and how you plan to purchase them, one day beforehand or a week in advance, etc. Work out the cost and make sure it fits within your budget. Identify pre-preparation tasks which could be carried out by you, helper if available, on a day-to-day basis according to the weekly menu. Supervise preparation of meals, snacks at the child care center as well as serving of meals, snacks to the children at your center. Health care of the child. Child is said to be healthy and normal when she is eating properly without fuss or refusing, sleeping well both at night and during the day, and playing contentedly with fretting or being irritable. An important part of healthcare is by physically examining the child. The following is the role of the teacher in examining the healthy child. Teacher's role in physical examination. Inspection of skin. The skin color and texture is an important indicator of some disorders. Fingernails. Note the color and shape of the fingernails. A fungus infection can alter the color of the nails. If the child has anemia, the nails are pale, pink and flat in shape. In jaundice, the nails turn yellow. If nails are long and dirty, they could be harboring the eggs of worms or diseases producing bacteria. Scalp and hair. Deviation in color and texture on the scalp may indicate ill health. See whether the hair is dirty. Are there hair lice? For example, if the hair is pale and brittle or if there are patches of baldness, it could indicate a protein deficiency. Examination of head and neck. Eyes, mouth, tongue, teeth, tonsils, etc. all display signs of health or ill health in various ways. Inspecting these is an integral part of examination of the child. Eyes. If the child is not able to see properly, that is comfortably and effectively, she should have the eyes tested, examined by a specialist. Dryness of the eyes, greyish-white spots seen on the surface, or changes in the cornea may indicate vitamin A deficiency or some more severe problem. Ears. Ear discharge is commonly seen in undernourished children who have chronic colds or sore throats. Look for discharge of pus. Mouth. Observe the mouth and look for the following signs. Teeth. Inquire about the child's dental history and ask about the family's knowledge and practice of oral hygiene. Throat. Though they do not seem to have any function, tonsils are the gateway to health. That is, they become infected easily. Enlarged tonsils or unusual redness in throat indicates infection. Neck. Pay attention to disfiguration or deformities in this area. Examination of chest. Examine the formation of the rib cage for normalcy and the chest movements in breathing. Record anything perceived to be unusual. Examination of the abdomen. Inspect the size of the abdomen. All through infants often have distended abdomen after feeding. Attempt to judge if the abdomen is of normal size or is enlarged. Examination of the limbs. Observe the size and the shape of the limbs. A thin limb may be the result of polio. Immunization. Children can be immunized against certain childhood diseases. They can thus be protected from some debilitating illness that are caused by infection. The vaccines and toxoids available for immunization are triple antigen against diphtheria, whooping cough and tetanus administered in a combination, polio vaccine, MMR against measles, mumps and rubella, BCG against tuberculosis, TAB against typhoid, cholera vaccine, hepatitis B vaccines specific, rabies vaccine, tetanus vaccine, gamma globulin, and certain protection against hepatitis and other infections by increasing resistance. Diseases against which immunization is effective. Some of the illness against which immunization is thought effective are described below. If the child is immunized against these diseases at the right age, the chances of affecting is very much reduced. The following are the illness against which immunization provides long-term protection. Diphtheria. Signs and symptoms. A dangerous disease caused by bacteria in the throat. It starts with a mild fever, but the child feels very ill. She will complain of a sore throat and have difficulty in swallowing. After a few days, a greyish membrane will be seen covering the tonsils in the throat. Transmission. It is spread by sneezing and coughing, etc. Treatment. Diphtheria is a very serious disease and should be heated in hospital. Whooping cough. Signs and symptoms. This condition starts with a fever, a runny nose and a cough. After about 10 days, the whooping sound will be heard when the child breathes. There is a persistent cough followed by a whooping sound. Transmission. Spread through coughing and sneezing. Treatment. Antibiotics should be administered. Tetanus. Signs and symptoms. It is caused by the bacteria making the muscles of jaws to contract to extend. The child cannot open her mouth. As the disease progresses, all the muscles will contract and eventually the child will die. Transmission. Transmitted by the bacteria which they enter into the body through open cut or wound. A newborn infant may even be affected through the umbilicus of ears. Treatment. This is a serious infectious disease that has to be treated in hospital. Polio. Signs and symptoms. The symptoms include minor illness, fever, headache, sore throat and nausea. In the serious condition, paralytic form of polio maker leading to paralysis of limb and other muscles. Transmission. Polio is caused by the virus which is spread through contamination of food and water by the feces of infected patients. Treatment. There is no complete cure for paralyzed limbs but can be prevented by timely immunizing the child by polio vaccine. Measles. Signs and symptoms. This common disease is caused by a virus affecting the skin and the respiratory tract, characterized by runny nose, sore eyes and mouth and a cough. Transmission. Spread through sneezing and coughing. Treatment. The symptoms can be cured by medication. Mumps. Signs and symptoms. Mumps are caused by a viral infection of the salivary glands where there is fever with pain on the sides of the face, particularly while eating. Transmission. Spread through sneezing and coughing. Treatment. Timely immunization is advised. Rubella, German measles. Signs and symptoms. It is caused by a virus. Symptoms include appearance of fever on the first day followed by rashes on the second day which later disappear. Transmission. Spread through coughing and sneezing. Treatment. Symptoms can be cured by medication. Note: Rubella is a dangerous disease if it occurs in a woman during first 3 months of pregnancy, where it affects the fetus, producing abnormal developments. Therefore, it is highly recommended that a woman gets herself immunized against this before she conceives. Cholera. Signs and symptoms. It is caused by a bacteria characterized by severe diarrhea associated with vomiting, and stools have flakes of mucus. Transmission. Cholera transmitted through contaminated water. Treatment. Cholera can be prevented by TABC vaccine. The following is the schedule of immunization that should be followed. Age and immunization. At birth, BCG and poliomyelitis oral drops. 1.5 months, DPT and poliomyelitis oral drops. 2.5 months, DPT and poliomyelitis oral drops. 3.5 months, DPT and poliomyelitis oral drops. 9 months, vaccine for measles. 16 to 24 months, DPT vaccine, polio booster. 5 to 6 years, DT, typhoid 2 doses. 10 years, tetanus typhoid. 16 years, tetanus typhoid.